Hi, my name is Kristina Puzinoof, and I'm a postdoctoral fellow at Penn State Hershey Medical Center within the Department of Psychiatry and the Sleep Research and Treatment Center. I'm really happy that despite the current circumstances with the virus, I'm still able to deliver this talk to your school district and hopefully shed some light on some important sleep related topics. So today I'm going to talk about some sleep during adolescence and ways in which you as parents can identify sleep difficulties and sleep disorders and then appropriate treatments for such sleep difficulties and sleep disorders. Okay, so for the purpose of this talk, I'll mainly focus on adolescence, but I wanted to start by showing you the recommended sleep duration, which is the total amount of sleep one gets per night across the lifespan. It's important to note that these are recommendations in the dark blue and that there are individuals who need more or less than the recommended amount of sleep. So as you can see in the graph here, newborns require the most sleep, and as we age, we require less and less sleep. But so to focus on adolescents and teenagers specifically, teenagers should obtain around 8 to 10 hours of sleep per night. However, the average amount of sleep teenagers typically get is about 7 hours, particularly on school nights. And research has shown that as teenagers get older, they get even less sleep. For example, about 1 hour less per year as they age. Therefore, teenagers are constantly dealing with this sleep debt during the school year and even within each week of not getting enough sleep on the weekdays and attempting to catch up on the weekends. Complex school schedules, given the early school start times, extracurricular activities, and demanding academic load often make it especially difficult for teenagers to obtain adequate sleep. On the other hand, teenagers in cyber school might have too much flexibility in their schedule, and particularly their sleep schedule, that they actually develop a delayed sleep phase schedule, which we'll talk about more later in further detail. But as you can see here, there's a lot of things going on during this time period, during this developmental time period, that doesn't bode well for sleep. And so I've talked to you so far about how much sleep adolescents should be getting and the fact that they are likely not obtaining enough sleep. But why is that important? So sleep is not just a state of rest. In fact, the brain is working all night long, and studies show that the consequences of sleep deprivation are apparent after only 4 nights of 1 hour less of sleep. So sleep is important because it promotes growth, it helps the cardiovascular system, it affects weight, it helps with your immune system, sleep improves your attention span throughout the day, and regulates your mood. All very, very important things. And it's important to note here that good sleep quantity, so which is the total amount of sleep per night that you get, is not synonymous with good sleep quality. So there can be various sleep disorders that affect sleep quality, and I'll talk more about those in detail later. All right, so now for some good news. We, and by we, I mean parents and teenagers, can play an active role and improve their sleep along with your own sleep. So these tips are not just specific to teenagers. You can use them yourselves if anyone's having difficulty sleeping and just wants to try some of these techniques. So as a first step, improving sleep hygiene is very important. Sleep hygiene is the behaviors and environmental aspects surrounding sleep. So for starters, limiting caffeine, especially in the late afternoon and evening. I typically recommend patients and families to not have caffeine past 2 p.m. And for starter, and limiting liquid intake in the evening so that they don't have to get up in the middle of the night to use the restroom for a lot of different times. Exercising and moving regularly throughout the day, but again, not too close to bedtime. A lot of times people think that, if I go for a run or if I exercise in the evening, I'll be super, super tired and knocked out. However, exercising tends to increase your physiologic arousal and cortisol, which is not sleep promoting for the body. Eating regular meals throughout the day and not going to bed hungry is important. And these are simple, but keeping your bedroom quiet, dark, and a cool temperature. Lastly, making sure that if they have a clock in the room, that it isn't facing your bedtime, that it isn't facing your bed, and that you're not able to look at it throughout the night. Because if someone has difficulty falling asleep, or if they can't go back to sleep in the middle of the night after getting up, looking at the clock, or clock gazing is what we call it, tends to make that difficulty worse. So making sure that the clock isn't visible. And again, these are just general sleep hygiene recommendations, very typical for you to find on the internet and things like that. But oftentimes, if there's more of a complicated issue, more than just sleep hygiene is necessary to help with sleep. Okay, so other tips for improving sleep are to wake up at the same time in the morning, regardless of how you slept at night. This is very important because what typically happens is teenagers sleep in after a poor night's sleep, which then serves to decrease their sleep drive and likelihood that they will fall asleep at the time that they want to the next night. Exposure to natural light, if possible, in the morning is important because light is one of the things that helps you regulate your sleep-wake schedule. And the light, even at natural occurrences, goes through your eyeballs and tells your brain it's time to be awake, it's time to be awake. So it helps to regulate that internal body clock that we all have. Using the bed only for sleep and nothing else. This is particularly difficult for parents to implement with teenagers, but even if they're in their room on a chair or on the floor doing those activities such as homework, watching television, or being on their phone, it's better than doing so in bed. This is the case because when people do all these other activities in bed, they form an association between the bed and those activities instead of the bed and sleeping only. Another strategy that can be helpful is to go to bed when you feel sleepy, not just tired or when you're done with the day. So a lot of times, teenagers have enforced bedtimes, and it's important for them to, I'm not saying that they shouldn't have an enforced bedtime, but it's important for them to be able to get out of bed if they're not actually sleepy. So leading into my next point here is another strategy that can be helpful is when you're having difficulty falling asleep, we recommend to actually get up out of bed and read a relaxing book or do a relaxing activity somewhere else in the house or even in the bedroom until you feel sleepy again and bring yourself back to bed. This seems counterintuitive, but essentially you're like training your brain to say, I'm not going to be in bed awake and frustrated and having a difficult time sleeping. The bed is for sleeping and sleeping only. So you break that association that you have with the bed and other activities as well as the bed and being frustrated. So there's no limit to how long you're reading outside of your bed for until you feel sleepy. And for those more extreme cases, there's no limit to how many times that you may have to repeat this process. So, for example, if someone gets out of bed, if they feel like it's been 20 minutes or so, they get out of bed, they start reading, they go back to bed because they're starting to doze off while reading in the chair, and then they get back in bed and their eyes pop open. So you just would have to repeat the process over and over again until you feel yourself falling back asleep. So a common sleep disorder, now I'm going to talk about common sleep disorders typical in teenagers and adolescents, one of them being insomnia. So insomnia consists of difficulty initiating or maintaining sleep, which is more than 30 minutes. Despite the adequate opportunities for sleep, insomnia often results in daytime consequences such as fatigue, mood instability, and specifically for teens, difficulty with schoolwork and paying attention throughout the day. insomnia it's sleep difficulties. These difficulties initiating and maintaining sleep are considered insomnia if they last for 3 months. And insomnia can be driven by learned sleep behaviors in childhood. For example, children who have difficulty falling asleep independently or always have the television on in their room at night as toddlers and during school age may persist to have insomnia as teenagers and or adults. So cognitive behavioral therapy for insomnia, also known as CBTI, is considered the first-line gold standard treatment of insomnia above and beyond any medication. This treatment consists of improving sleep hygiene, like I just spoke about, as a baseline, and then various sessions. Ideally, it's on a weekly basis to address things such as stimulus control, which is essentially the things I just mentioned before, regarding using the bed only for sleeping and getting out of bed when you have difficulty sleeping. So again, breaking that association between the bed and being frustrated, or the bed and all these other activities that people typically do. And then the other three pieces, such as sleep restriction, cognitive therapy, and relaxation therapy, I'll talk in more detail in the next slides. So sleep restriction is essentially restricting the amount of time an individual spends in bed in order to increase the amount of time they spend in bed sleeping. So a lot of times patients with insomnia spend maybe 9 or 10 hours in bed, but they're only sleeping for 6 of them. So that is not necessarily a good thing, because they're spending almost half the amount of time that they're in bed being frustrated or trying to sleep, not actually sleeping. So what we do initially is restricting the amount of time that they get to spend in bed so that they increase the time that they're in bed sleeping, and then gradually, by 15-minute increments, increasing their time in bed until they reach their desired goal. And often for teenagers, that is 8 or 9 hours. And for adults, that would be 7 or 8 hours as well. Cognitive therapy consists of two components, constructive worry and cognitive restructuring. So constructive worry targets the worry and racing thoughts, or the racing mind, that typically occur in insomniacs. And that racing mind typically happens either right before bed, or when they're trying to sleep, or when they're trying to return to sleep in the middle of the night. And so in order to avoid having those thoughts while in bed or at bedtime, we schedule a time during the day in which the patients are instructed to do worksheet type material, and they're instructed to write down the 3 most likely things to keep them up at night. So for example, my battery on my car died. This is not necessarily a worry of an adolescent, but maybe more so an adult. So my battery on my car died, and I'm not going to be able to get to work or get to where I need to go. So then we typically ask them to write down several solutions or steps in which the people are going to take in the next couple of weeks or days to address this issue. So you're essentially finding solutions for a problem, and then reminding yourself, if once you get into bed, if you're having those thoughts or those worries or racing thoughts, to say to yourself, I've got this, I've handled it, I'll handle it tomorrow. Now is not the time to be thinking about these things. So really just trying to shut off those thoughts and address them at other times throughout the day. And then cognitive restructuring focuses on the unhelpful beliefs and attitudes about sleep that people with insomnia typically have. For example, I'm not going to sleep at all tonight, or it's going to be an awful day because I didn't get good sleep. So with thought records, similar worksheet type things, we help patients identify these thoughts as a first piece, and identify that they're unhelpful, and then develop replacement thoughts for each one. So you're again restructuring the way you typically automatically think about sleep and the consequences about sleep, and replacing them with positive ones. And lastly, relaxation therapy targets the physical feelings of anxiety and stress at bedtime that patients with insomnia have. So this is more so your muscles feeling tense, sweaty, heart racing, heart palpitations, things like that, that are physical signs of anxiety and or stress that tend to interfere with sleep if they're happening at bedtime or in the middle of the night. So we use deep breathing techniques and muscle relaxation strategies that we teach in the sessions with the patients, and then they are instructed to practice them throughout the day until they get good at them. And by get good, I mean until they're able to actually feel the results and feel the physical difference of having the anxiety and then not having it, and then using those strategies at bedtime to help relax their bodies. In addition to the behavioral and environmental changes during adolescence, there's also a lot of physical changes that occur. One such change is their internal body clock. Everyone has an internal body clock, also known as your circadian rhythm. And your circadian rhythm controls your sleep. Okay? And it controls a lot of other things, but I'm just going to focus on sleep for today. So with the onset of puberty, adolescents' internal body clock is delayed and they prefer to go to bed later, and so they have an eveningness preference. So this is very typical, as I'm sure everyone, sees here at home. And then their sleep pressure also, which is their sleep drive or their hunger for sleep, essentially how tired you are at the times that, everyone else is typically going to bed at 10 or 11 o'clock, so their sleep drive is lessened and decreased during adolescence as well. So this, the biological changes occur during adolescence don't really serve to help the current conventional schedules that teenagers typically have with waking up really early in the morning, given that they have a shift delay in their sleep schedule. So this delayed pattern can develop into a circadian rhythm sleep disorder, delayed sleep phase type. Not every teenager has this, but teenagers that really have difficulty remaining awake throughout the day because they physically cannot go to bed any earlier than about 1 a.m. is the cutoff that we really see here. And they go to bed very late, and if they're still going to school, they're waking up obviously early for school, exhausted during the day. The pattern typically is that they are so tired during the day, find it so difficult to do schoolwork and to remain attentive and to sometimes even attend school that it interferes with their school attendance for sure. These kids and teenagers and adults even have circadian rhythm disorder, tend to be the most alert in the evening times, most productive, feel like they're most alive in the evening. They often miss breakfast or don't prefer to have breakfast and then have lunch, dinner, and another snack, quote unquote, in the evening, which is also served as their third sort of meal of the day, which is just delayed in the evening and considered a snack by others. So this can be mistaken for insomnia in some cases because these teenagers often have difficulty falling asleep at the time that their parents want them to for conventional school schedules, but in fact their bodies just aren't ready for sleep yet. And these patients are often sleepy throughout the day, like I spoke about. So a lot of times in the clinic we see patients come in for a chief complaint of insomnia, but it's actually a circadian rhythm disorder. It's just that they physically can't fall asleep and they're not tired for bed at 10 or 11 o'clock. Okay, so treatment for circadian rhythm sleep disorder is very straightforward and simple, and if followed in a consistent manner, can really help and change these kids' lives from the impairment that they were before. So it consists of shifting their sleep schedule back by 30-minute increments. So shifting their sleep schedule, meaning their bedtime and their wake time, back by 30 minutes with the help of a morning bright light and low dose time melatonin. So a morning bright light, in this picture here in the middle, they come in all different shapes and sizes, but it's essentially a little electronic device that emits a certain lux of light, and we ask teenagers to use the light in the morning for an hour when we're asking them to wake up, and the light goes through their eyeballs and tells their brain it's time to be awake, it's time to be awake, and helps reset their clock. In addition to melatonin, so melatonin is a naturally produced hormone in your body, and it's naturally secreted about 4 hours before your typical time that you fall asleep, not the time that you get into bed. So we use low dose, which means 0.5 or 1 milligram of melatonin about 4 hours before their bedtime that we're asking them to get into bed. And with the help of the light and the melatonin, which are the typical things that control your circadian rhythm and your internal body clock, we are able to move their schedules back to their desired bedtime and wake time. And that's 0.5 or 1 milligram about 4 hours before bedtime. So melatonin may be beneficial. There's been some research out there to show that it's beneficial for children with ADHD and autism spectrum disorder to help them settle at night. One of the side effects is that people or children who use high doses of melatonin for extended periods of time have been found to show a suppression of melatonin production in their bodies. So that's even more support for the use of a low dose times melatonin. And just as a little tidbit, there's no FDA approved sleep medication for children, and not even melatonin. So melatonin can be helpful if used in the proper manner. However, as I said in the beginning, it's sold over the counter and at very high dosages, and there's really not good clear-cut clinical guidelines on how to use it and when to use it for physicians. So switching gears to talk more about biological sleep disorders, such as sleep disorder breathing or obstructive sleep apnea. Symptoms consist of excessive daytime sleepiness, so feeling extremely sleepy during the day, so much so that you actually fall asleep in the car or on the couch or watching TV, things like that, despite getting enough sleep at night. So sleep apnea is one of those sleep disorders that affects sleep quality. So you can be getting enough sleep quantity, you can be getting enough sleep, but if you're having difficulty breathing at night, it affects your quality of sleep. So other symptoms are loud, frequent snoring, pauses or gasping for air in the middle of the night, restless sleep, grinding your teeth, excessive sweating, mouth breathing at night, overweight, and a family history of sleep apnea. So we typically assess sleep apnea with a overnight sleep study. And then if you're found to have sleep apnea, which is essentially we assess the amount of times, if any, the patients stop breathing per hour, and if that number is above a clinical cutoff, depending on the specific case, if it's a younger child and they still have their tonsils and adenoids in, a referral to ENT will likely result in a tonsillectomy and an adenoidectomy. If somebody already has their tonsils out and they have bad apnea still, they would recommend a CPAP mask, which is continuous positive airway pressure mask, and it essentially flows air through your passages throughout the middle of the night. And then another one, if it's more on the mild case, is weight management. So weight loss can be very, very effective for managing mild sleep apnea cases. Periodic limb movement disorder is another biological sleep disorder that can affect your sleep quality. So again, somebody can be getting enough sleep, at night per hours, but feeling sleepy throughout the day, and that would indicate another biological sleep disorder. So symptoms are rhythmic kicking or twitching of your feet or legs when you're sleeping. So this is particularly hard for parents and individuals themselves to know that it's happening because you're not watching your children sleep at night, and if you're sleeping, you're not aware that you're rhythmically twitching. So it's hard to say, but it is more common in children and adolescents who have ADHD or autism. And we would assess this with an overnight sleep study similar to the sleep apnea, the same test. And in addition to the breathing apparatuses that we assess your breathing with overnight, we assess how many times, if any, you have these rhythmic twitching or jerking of your legs or feet when sleeping. And so if you're found to have a high level of these at night, then we typically ask their primary care physicians to have blood work done to check their iron and or ferritin levels to see if they are low to normal. And so even normal levels of iron and ferritin can lead to periodic limb movements. And if they are found to be low or normal, we would just treat this with iron supplementation. And folks tend to see an improvement in their sleep quality from just iron supplementation for this specific disorder. All right, so here are some resources where you can find consultation for any of the things I talked about today and other sleep organizations. So at the top here, I have the providers that treat the things we talked about today in Penn State Health. And then there's other organizations at the bottom who can help find clinicians to treat sleep disorders around the country. If there are any questions or need for clarification, please forward any questions to Chelsea Singleton. She's the person who I've been in contact with to coordinate this talk. And I thank you so much for your attention, and this concludes my presentation.